Well, hello, everybody. Welcome to our webinar today. My name is Dr. Stephen Moore. I live in Jupiter, Florida, and I'm the founder of MD Solution, and we are the largest medical distributor for Pharmanex, the antioxidant scanner, and their product line. And today we've got a very exciting call that we're going to go through. I give a talk similar to this throughout the country and do some international speaking. And what you're going to hear about today is a technology that is creating a major paradigm shift in healthcare. It's empowering physicians and patients to really take charge of their health and dramatically improve outcomes, as well as improve physician lifestyle and bring in some significant cash flow into the practice. And this is the BioPhotonic Scanner. Many of you have seen this, and this is what we're going to be focused a lot on today, and how this is being used in clinical practice as well as the business side. We have physicians that have added over $100,000 a year of profit into their practice since they've added this technology in, and have also been helping their patients dramatically. And what we're going to talk about on this webinar is, number one, the role of nutrition. Number two, measuring antioxidants, supplementation in that market, why Pharmanex and what makes Pharmanex unique in the marketplace. Some clinical experience, as well as the revenue. And at the end of this, we'll ask you to fill out a survey just to give us some feedback on what you like best about this webinar, and if you'd like somebody to follow up with you. We do have a Q&A session here. So for those of you that are watching us live, you'll be able to submit any questions into the chat, and we'll do our best to answer them at the end of this presentation. I'm excited to introduce Dr. Ben Gonzalez to you. Dr. Gonzalez is the medical director to Atlantis Medical Center. He has a tremendous background in functional medicine, hormones, weight management, aesthetic surgeries. He's a leading expert in his field around the world. And Dr. Gonzalez was recently the keynote speaker over at the AMMG conference, which, if you guys weren't there, is one of the most significant anti-aging conferences. He's been a speaker there multiple times. He's been a keynote speaker at A4M, and just a really great doctor. He's somebody that I trust my health with and my family's health with. And Ben, thank you so much for taking your Saturday here to spend some time with us.
My pleasure. My pleasure. By the way, he made all that stuff up.
Did it sound good?
Sound good.
All right. Is there anything else that you'd like to embellish more, Ben?
No. Thank you. Thank you, Steve.
All right. Well, Ben, I'm going to flip through your slides here. And so we're going to have Ben talk a little bit about a review of some topics that he went over at the AMMG conference, and also talk about how he applies the antioxidant scanner and some of the Pharmanex products into his practice, because this is something that he's been using for quite some time. And he'll be able to blend in not only the science, but also his clinical experience as well. So Ben, I'm going to turn to the remainder, or actually the next several slides, over to you, and then we'll roll back in.
No problem. And are you clicking the slides through for me?
I will.
Yeah, you can do the whole slides. The whole slide. We don't have to click through each line. So as you can go back one. So at those of you who are at the AMMG conference, you can go back one.
Well, this is the first slide, and then the next one.
Yeah, that's the first slide, right?
Yep. Okay.
Yeah. So those of you who are at the AMMG conference heard me speak about hormones, estrogen, progesterone, testosterone as a link in a systems biology approach in taking care of individuals, and not thinking in a linear thought process. The whole point of my discussion was not thinking linearly when taking care of patients, rather thinking from a systems biology approach in managing individuals, because it's not just about 1 + 1 is 2, 2 + 2 is 4. Low testosterone plus testosterone means a better individual, or a better physiology. It's about the complexity of the balance in the systems in an individual systems, and that's the same with antioxidants, nutrition, and hormones. They all work together. So I discussed at the conference about optimizing versus functional approach, as the prevention is the primary approach to healthcare. And this is in contrast to our usual approach in medicine, and that is wait till a person gets sick, and then manage that illness, manage that disease process, and then wait for the next thing to happen. Go on to the next slide, please. So just as a quick reminder, the difference between the pathological approach and a functional approach. The pathological approach in an individual's overall health is the study of the causes of the impacts of the overall disease states, and looking at those labs within that, and those parameters, waiting for a lab to fall outside the parameter before we do anything about it, instead of trying to catch things early and looking at the combinations of labs as an individual. And then a functional approach is just that, the study of the physiological state, allowing for the prevention of pathology. So looking at labs, looking at not just labs, but looking at listening to the individual, listening to the symptoms, signs and symptoms, with the idea of optimizing who they are. I put my dad there as an example, but I talk about a story about how my dad's health and what happened. But the bottom line is just taking a look at the individual overall. Go ahead and do the next slide. And then, yeah, go through the whole, you can go through all the, yeah. So, so AMG conference attendees, they in most of these types of conferences, what do the attendees come to learn about? Well, they learn about, in this particular conference, we're talking mostly about hormones and how they work together to optimize an individual's overall health. And unfortunately, we get so caught up, physicians and providers get so caught up in advanced knowledge that we forget about the basics. We forget about that, nutrition is medicine. We get these individuals who, we get clinics and providers who we're looking at all the different aspects of someone's health, and hormones in this case we're talking about, that we forget about how nutrition and antioxidants play a role in hormone receptor health, the availability of hormones, and converting hormone that's tied up in a binding globulin, and how to release it into the free state to allow for a physiologic response. We forget about all this stuff. We forget to discuss the HPA axis, stress, allostatic load, epigenetic effects on overall health. Go ahead and go to the next one. And we do this because we're trained to think about homeostasis, the balance of things, and we're taught about homeostasis in the basic biology, high school biology, that an individual, an organism remains in a certain range of physiological parameters to maintain stable function, and whenever there's outside stressors that go outside that range, that your body fights to stay within that range. That's kind of not how the body works. It's more of from an allostasis or an allostatic point of view, and where the organism constantly varies and adjusts those physiologic parameters to maintain stable function. In other words, these ranges shift, and so if somebody's blood pressure has been a certain way, for example, for in their 20s and 30s, but then they have this what's called allostatic load, these epigenetic changes, poor diet, stressors from above, obesity, poor diet changes, and we're not catching those things early. Well, then you get long-term effects of higher blood pressure, poor diabetes, poor blood sugar regulation, metabolic syndrome, insulin resistance, etc. I'm going to the next page. Thanks. This is just a slide that illustrates all of that. You get this outside stressors, whether it's obesity, whether it's epigenetic changes in a negative way, the allostatic overload, and then that causes, and in this case, we're talking about hormones and all their negative results of all these different changes, including poor diet and poor antioxidant levels. So then you get poor receptor response, and you get decrease in luteinizing hormone, growth hormone, testosterone, estrogen, et cetera, et cetera. And I'm not talking about the perimenopausal woman or the 60, 70-year-old male. I'm talking about 20s and 30s. I'm talking about early on, because we're thinking about prevention, right? So as a result of this allostatic overload, you get advanced, you get obesity, advanced visceral adiposity, you get elevated blood pressures, elevated heart rates, poor insulin action. Next slide, please. And you can click a couple times for the wording. There we go. One more. There we go. That's it. So my wife is a perfect example of this, where this woman that you see here in great shape, has been in great shape all her life, who's a vegetarian since she's been since she's a teenager, who's always been active, had her first heart attack at the age of 38. So why would that happen? Someone who's a vegetarian in great shape, active all her life, have a heart attack at the age of 38? Because we forget about these other outside allostatic load. We forget about all that her body works in our bodies work in a systems biology approach. So when she had these kind of minor complaints through her 20s and early 30s, we weren't thinking about looking at her overall physiologic, all the physiologic parameters to include her antioxidant levels. So after she had her heart attack, she was, of course, well taken care of by the cardiologist, who was taking care of what? Her heart, right? So, so they're taking care of her heart, but what are they forgetting? Forgetting about hormones, forgetting about nutrition, forgetting about, I mean, she's a vegetarian, so we assume that that she's eating properly, and she's not a potato chip ice cream vegetarian. She's an actual had 4, 5, 6 servings of whole fruits and vegetables a day, but that's all we think. We don't think about, is she absorbing? Is she? And so we didn't measure that. So make a long story short, her vitamin D. But I met her 4 years after her MI. Her antioxidant levels, as measured by the BioPhotonic Scanner, was nil. It was 0. It was so low, it was not measurable. This is a vegetarian, right? Her vitamin D levels were I think, in the single digits. Her hormone levels were all over the place and not being managed, because all we were thinking of at that time, or her specialists were thinking of, was her heart, her lungs, but not as a systems biology approach, as a human being who needs to be looked at from the perspective of her overall health. Next page, please. So there are multiple studies correlating antioxidant status with optimizing hormone and hormone receptor function. Poor antioxidant levels, low antioxidant levels, whether you're a vegetarian or not, you have to be measured, increase the chances for issues with hormones, including infertility, early menopause, poor sperm production, erectile dysfunction. So what we're being pushed in the mainstream perspective is, oh, erectile dysfunction, we'll give them more testosterone, or give them shots, or medications that help kind of put Band-Aids on these types of things, but don't actually fix the problem. Next slide, please. There we go. So the bottom line is estrogen, progesterone, testosterone. If you're having issues with these hormones, and you're taking care of these, and you're a physician, and I'm talking from the perspective of those of you who are listening, who attended the AMMG conference, is that we in these types of conferences, we think, okay, someone's perimenopausal, and we got to manage estrogen, progesterone, testosterone, but it's more than that. It's managing their antioxidant status. It's managing the nutrition so that the hormones that they are taking are working. Because we've all had this same patient come in that has been on hormones, and their symptoms are coming back. We don't know why. I've been on testosterone, Dr. Gonzalez, for 2 years, or came from another clinic and have testosterone, but they won't give me more because I'm already maxed out on my testosterone. When we haven't managed their antioxidant status, their nutrition status, their receptor function. And so we don't think of it from that perspective. The animal studies and human studies, yeah, keep going. There you go. Have suggested that oxidative stress has an important role in follicular growth, in the development of things like endometriosis, infertility, regulation of angiogenesis, so of healthy vascular function. These are all citations. I'm not going to bore you with going over each and every one of these studies, but it's well established. There's nothing new about this, about antioxidant stress, oxidative response for hormone receptor function. We've known about this for years. I suggest you go through some of these citations and take a look at how all this matches, because the bottom line is this. Next slide. The bottom line is this, is that we all, and I'm just using doctors, picking on doctors here on this slide, but all of us have outside stressors, and we need to manage those stressors. And oxidative stress plays a powerful role in not just hormone production, hormone receptor function, but in overall physiologic health, brain function, adrenal function, thyroid function. And we don't want to wait till somebody gets sick, until they're 38 years old, vegetarian, having an MI. So the best way to do it, and how I utilize in my practice the BioPhotonic Scanner, is that every single individual that walks through the door, that walks through my clinic, gets scanned. Whether they're here for an aesthetic procedure, whether they're here for nutrition, weight loss, for cancer management, whatever it is, every individual that walks through the door, including the mailman, gets their antioxidant scan, because that's a most powerful screening tool that I can do within seconds that gives me the power to give a narrative of nutrition in that individual's health. We all know that discussion of nutrition is labor intensive as physicians. This slide's more discussion, more citations, and what it correlates with. And I'm going to talk about autoimmune in a second. Stay on this slide for just a second. So we all know it's labor intensive to talk weight loss, to talk nutrition when it comes to physicians and patients. We have a short period of time. The BioPhotonic Scanner allows a quick, it gives you a number right away that you can present to the patient and put it right in front of them and say, here it is. You either do something about it or you don't. It's what we do with all our other things too, right? Okay, your cholesterol's 285, your LDL particle numbers are over 2,000. Here it is. Your hemoglobin A1C is 6.9. Here it is. Your antioxidant levels are low. Here it is. And then you do something about it. And so what do I do about it, Dr. Gonzalez? What do I do about it, doctor who's providing me healthcare? Well, first, we got to make the changes that you need in your diet. And that's the number one thing. The number one thing is not, no, you got to take a pill. No, you got to take a bunch of supplements. The number one thing is change your lifestyle and change your diet. And it brings that narrative right away. The second thing, if you want to escalate that and start right away, is begin supplementation. And powerful responses. I make every single one of my surgical patients not only take the test, of course, but if their antioxidants are low, and even if they're in the right place, I want to maximize that level, right, to allow for maximal healing. And so I put them on the products, and the products that work are the ones that show a level. How do you know a medication is going to work? Docs out there, how do you know a medication is doing its job? You measure. Well, how do you know someone's antioxidant levels are elevated? Well, you measure the BioPhotonic Scanner. And with my wife, who had zero, she had zero, her level was so low, it was not measurable. It took me 18 months with maximizing and being aggressive with her antioxidant, with her gut health, and improving her gut and maximizing the antioxidant intake. It took me 18 months just to get her into the near optimal range, and another 3 years to get her into the optimal range. So it's not going to be easy. It's not an easy thing. It can be, but it's not an easy thing for those people who've had issues that led up to that for years, that led up to a disease process. So this is just a list on this slide. It's just a list of the different things the citations that correlate with the different things that have to do with antioxidants and all these different issues: sleep deprivation, metabolic syndrome, sex hormone dysfunction, cardiovascular disease, MS triggers, cancer triggers, osteoporosis, autoimmunes. I want to spend just 30 seconds on discussing autoimmunes, autoimmune issues. So when I was, keep on this slide. When we're going through medical school, Hashimoto's, autoimmune disease processes were the zebras. Now it's like everybody has some sort of autoimmune issue. Lyme's is prevalent. Hashimoto's, everybody has Hashimoto's and thyroid disease. Everybody has a gluten sensitivity and allergy process, an allergy. Why is that? Well, that's a whole nother discussion, but the bottom line is, if we're not managing the basics, if we're not managing the nutrition, the diet, and if we're not bringing the narrative early, which the BioPhotonic Scanner does, then, people are kicking their own butts, just like this slide. Go ahead and next. So this, I just realized there's a typo there. Not the tight tool, but the right tool for screening. The right tool for screening is the BioPhotonic Scanner. Simple, efficient, effective tool for bringing in the nutrition narrative right away. Here it is, patient. This is your issue. And here's what you can do about it. So think about the actual underlying issues, bring the narrative about small lifestyle changes early in your discussion with the patient. Use the antioxidant screening tool, the BioPhotonic Scanner. Ask the individual who came to you for hormones in this context that we're talking about here, for hormones, and say, hey, look, I might be able to give you more hormones, but let's make those hormones work. Let's maximize their ability to do their job in your body. You don't want more hormone, you want more efficiency in the use of hormones in your body. And diet, nutrition, antioxidant status, powerful role in that. Next.
Well, Ben, what we're going to do here.
Yeah. So, Steve, I'm going to turn this back over to you, but I want to mention one more thing, and that is don't hesitate to contact me afterwards about how I utilize these things. This is a quick, a quick discussion on this, an introduction basically. But I can tell you specifically how I manage and how I do that for my surgical patients, for my weight loss patients, and for my hormone replacement patients.
Well, Ben, we might, if we get some questions during this webinar, we'll maybe have you answer some of that during the Q&A. So as we jump into this technology, this is the BioPhotonic Scanner. It's a rapid test now. We can do it in 30 seconds. It's portable. It's battery operated. It runs off an iPad. It costs less than $2 to actually perform the test. And what we're finding is that 94% of the people that do that have that test fail. We've done about 30 million scans with it. So this is a really big problem that we have is people are having deficient antioxidants, loss of oxidative stress and inflammation, and that's causing a whole host of issues. And what we're finding is when they switch over to the Life Pack and some of the other PharmaNex products, we see close to 100% response rate within a couple months. We can see significant improvements. Now, this device was not developed by PharmaNex, who makes the supplements. It wasn't some gadget they made to sell more vitamins. This was actually funded independently from the National Institute of Health for disease risk assessment. It was developed at the University of Utah Center for Biomedical Optics by these two scientists. And it's based on Raman spectroscopy, which is Nobel Prize winning science. There's other applications in science to Raman spectroscopy. This is the first time it's been applied to biological tissue. And essentially what happens is a 478 nanometer blue light goes into the skin. That frequency vibrates the carotenoids and they scatter back a different frequency. I'm sorry, this is supposed to be 500 and coming back at 510. So 478 goes in, 510 comes back. And the amount or the intensity of that light coming back into the photoreceptors actually determines the concentration of those carotenoid antioxidants in the skin, which is a reflection of the rest of the body. We look at what these carotenoids are doing and what the other antioxidants do. So this is obviously a cross-section of the cell. Vitamin E sits within the cell membrane. You also have a vitamin C, which is a water-soluble. And then you have these beautiful carotenoids, which can sit at different angles within the cell membrane. Remember, these are fat-soluble, so they sit within the phospholipid bilayer. And we get these from colorful fruits and vegetables. So the reason why we know that colorful fruits and vegetables decrease risk of all diseases is because they're actually providing the carotenoids, and this is the fundamental protection that the cells have from oxidation. Now, Ben, I don't know if you're still there with us or not, but you can see these squiggly curly cues. These are these hormone receptors, right? So these are when the membranes oxidize, the function of that cell, not just the membrane being a bag that keep things in, there's a lot of function that takes place, and these hormone receptors get oxidized. And that's one of the reasons why, you have these patients that Ben talked about that when they have a lot of oxidation, they're not responding to a lot of these therapies very well. Ben, do you want to add anything to that? Okay, maybe not. So
no, just the bottom line is you can dump all the hormones in somebody you want. You can give them hormones as much as you want. If you're not managing the way the hormone receptors are responding, then you're not going to get the effect. And this is one of the things that we see a lot in a lot of clinics, a lot of patients that come to my clinic from other clinics, because the patient will come in here and say, I want more hormone because I think that's what's going to fix me. When in fact, the majority of the time, and you will see this in your practice, the majority of the time, when you manage their antioxidants and their nutrition, especially the antioxidant and the receptor function, I cut the hormones in half, the amount of hormone they're taking in half. So less issues, more efficient use of hormones.
Yep. And so we all know free radicals, antioxidants, free radicals are the bad guys. These are things that are pounding your cells. They actually, the more free radicals you're exposed to, the lower your score is going to be on the device. And the more antioxidants you're getting into the system, that's getting into the tissue, the higher your score is going to be. So what's nice about this technology is it's really measuring this battle of, or this balance of who's winning this battle between free radicals and antioxidants. This technology has evolved over the years. So it started with Nobel Prize winning science. It then in 1999, the first device at the University of Utah, where it was being used for cancer research, kind of looked like a weapon of mass destruction. I mean, it's not something you could put in your practice. This took up a small room. And then they had a portable one, or somewhat portable one, here in 2002. And then I started with the company in 2003 with the first generation of the technology, which was laser-based. They were the most innovative company in the United States, along with Apple Computer, because of this technology. They then advanced the technology in 2006 to an LED. They then used it for studies on Mount Everest, on the Sherpas, looking at oxidative stress. And then they came out with the latest version, which is the one that's ready for mass market, which is the third generation LED-based device. And they've won many other awards along the way. So some validation behind this technology. This is well substantiated. This is a 10-year study that was done with the USDA and Yale University, concluding that this device is a biomarker of health related to diet and lifestyle risk factors for disease. And we all know that diet and lifestyle are the number one causes of preventable disease. And this is a very easy way to address it. And this was why the NIH funded this device. There's now over 90 clinical studies that have been published in peer-reviewed journals validating the technology, including studies from Stanford University. Texas Tech Medical School has several of them in their clinic. It's been used and presented at major ophthalmology conferences. It's been featured on the Dr. Oz show. The genetic science that we're going to talk about a little bit later on in this webinar was featured on the Discovery Channel. And this is the first supplement company that got the approval to sponsor the U.S. Olympic team. They've been NSF certified, and they're also listed in the physician's desk reference. And so when Dr. Oz had this on his show, this was not a paid for advertisement. They were doing a show about antioxidants and cancer. Dr. Oz had scanned 75,000. He actually scanned live on the show, so we were all a little nervous, but he definitely walks his talk. And some of the things that he said is that carotenoids are powerful antioxidants. They're really our first line of defense. Low levels are associated with cancer, heart disease, Alzheimer's, and many other diseases. And high levels protect us from a myriad of diseases. In fact, breast cancer is one of the biggest problems that women have. One of the top cancers. It's affecting 1 out of 6 women. And there's a study out of Harvard published in the Journal of National Cancer Institute that showed that high levels of carotenoids are actually will significantly reduce risk of breast cancer. And so this is something that if you're seeing women, which most of you are, this is a test that should be done on every patient. It's easy to do. It's not causing any damage to the tissue. And this is a number that you and the patient can be easily empowered to improve this score and improve that protection. So we no longer, we now understand that the getting optimal nutrition from our diet, it just doesn't work for the majority of people. The USDA concluded with a 22,000 person study that nobody was getting optimal nutrition from their diet. They weren't actually even getting the minimum RDAs. 17 years ago, JAMA even published an article saying everyone should take a multivitamin. According to the CDC, it was somewhere between 50 to 70% of people were buying supplements. The latest figures that I just read from a study, 77% of your patients are buying a supplement, whether you want them to or not, whether you're recommending it. And there are a lot of problems with that. There's no easy way to measure effectiveness. And there's all kinds of issues if they're going out there to GNC or Target or Walgreens or Vitamin Shop, which is where most people are buying things. I mean, they even had a lead contamination issue, not once, but twice on their products. And so physicians are realizing that it's their responsibility to give better guidance and better recommendations to their patients. And this is a big blind spot that we can now see. When you can measure your patients, you can uncover this, put it in front of them, and really make nutrition fun and make it really simple. The supplementation market is growing by $1 to $2 billion a year. It's $40 billion right now and continuing to grow. And so this is a business that is really ripe for physicians to get involved in. It continues to grow every year as reimbursements continue to decline. Do you want to see more and more patients and make less pay, or do you want to add more value to the practice, see less patients, and redirect their spending to a better quality product? And that's what we're able to do here. And patients are confused. They don't know what to take. They don't know if it's working. So they just go out there. And if you ask patients, do you take supplements? Most of them will say yes. And then if you ask them, are they working? They'll say, I don't know. And by being able to shift that recommendation, away from the manager at GNC and back into your practice is really a prudent thing to do. Your patients need some guidance. And so when I first saw the scanner, it was a very easy technology for me to understand and see the value of having. But I had probably 10 different other brands of supplements that I was looking at and having accounts and trying to figure out which ones to recommend. And if you've looked at supplements, you're recommending supplements, you're probably just as confused as I was. Every company's telling you they're the best and they're all lying. How do you really compare these different brands? And so what I loved about Pharmanex is, number one, they had a way of measuring. We know that people that have poor diet and lifestyle score poor. The smokers are in the red zone. Average Americans, not much better. And the average people taking the Pharmanex Life Pack and Age Lock Youth combination, we see 100% to 200% improvements in their score. We're talking about really significant improvements that we're seeing. My personal score went from 31,000 in that yellow zone up into that platinum zone. My high has been 90,000. My children are in the green, blue, or platinum zone. My wife went from nearly the red zone up into the platinum zone. Her allergies are gone. So we see a lot of correlations to health related to the antioxidant score. And this is something that, makes a lot of sense when you look at the literature. And so when we look at the scientific method or the medical model, we like to evaluate things, recommend things, and reevaluate things. So whether we're measuring blood pressure and having a treatment protocol and retesting it, whether we're looking at vitamin D and we're seeing lots of deficiencies, whether you're measuring hormones, you would never just give someone hormones without measuring them. Yet a lot of people are taking supplements without really a pre and post measurement. So what we're here is to fill in those blanks, make it really easy, not have to have these very expensive blood tests that are really difficult to get nutritional panels for and read them, to really make something really simple. Have a very simple 30-second test, put them on a product that's proven to work, and then retest them in 60 days and see that improvement. And so the way it works is you get a baseline score for your patients. You start them on the Pharmanex therapies. These are the only supplements that have been proven and guaranteed to elevate scores within 2 months, or patients get their money back. Patients will start to improve their behavior when you can measure it, because it makes it fun for them. It makes it accountable. And in a couple months, you'll have them come back and you'll see an improvement. And that keeps them motivated, keeps them compliant. And then they'll probably take their supplements more effectively, more consistently. They'll probably up their fruit and vegetable consumption. And it'll typically take about 4 to 6 months to fully saturate the tissues, and then being able to monitor that to keep those patients on track. We don't just take blood pressure once. We monitor blood pressure. We monitor things in healthcare, and now we can monitor antioxidants. Now, when you start to learn about Pharmanex, because I wanted to know, okay, I love the fact that they've got a testing device, but why should I recommend their supplements over the other brands I had? And I started to look behind the curtain and look at their research engine. The boxes really don't tell us all that much. And so when I looked at Pharmanex, the founder, Joe Chang, was one of the chief scientists over at Wyeth. He invented a few drugs. Michael Chang was the director of chemistry at Merck. He developed the first statin from red yeast rice. He made that discovery. And Carl Djerassi invented the birth control pill. So these weren't your average scientists or a couple doctor gurus that decide to start a supplement company. These guys were on the drug discovery side for pharma, and they had researched over 50,000 plant samples during their careers. And so they really understood how to identify compounds, how to extract them, how to standardize them, how to do the safety and clinical studies on them. And that was their reasoning for starting Pharmanex. They left the drug company to really apply a pharmaceutical approach to natural product development. These are the labs and buildings that they own and operate. On the top right here, this was a $150 million complex that they built. 2 floors of that is an all state-of-the-art lab. On the bottom right, this is a $50 million facility in Asia. And on the top left, this is our training facility, which will have an event there coming up in January if you'd like to attend with us. These facilities house about 100 full-time scientists. About a third of them are PhDs. They work with about 150 other scientists from leading scientific academic institutions. And so when I looked at this company, there's not another nutraceutical company that is even close to the research capabilities and infrastructure and quality control that Pharmanex has. They have PhDs in all different disciplines because not one scientist knows all the answers. The science, especially in nutrition, is very opinionated. It's very complex. And so you need a lot of different scientists with a lot of different PhDs all working together to comb through that literature. And so, Ben, I know that when I first had presented this to you, you said that you had known one of our scientists and from your work over at the NIH and the National Cancer Institute. I know that you had taken some of the product without me knowing to the NIH to test them behind the scenes to see what they were. So maybe if you could share a little bit about that before we move on to what we're talking about here with epigenetics.
Yeah. Well, I didn't know Mark Bartlett personally while I was there. I just knew of him and worked at NIH when we were doing antioxidant research there. And there's a million products out there. And I had taken some what I thought were trustworthy products to NIH years ago, 20 plus years ago, just to, and what I mean by NIH, we take it to the labs since I had access to the labs, take it to the labs and run it through the spectrometer, and just to see what's actually in it. And we found that the majority of compounds that were sold over the counter had less than 10% of of the compound they said was in the ingredients, and less than 10%, the majority of what we were testing. And of course, I've been skeptical of over-the-counter compounds for a long time. So when I saw Pharmanex's compounds, just another compound that another over-the-counter that I took over there. But what was surprising is that what they said was in each of the compounds. In particular, we took the antioxidants, we took Vitality, and we took the product Vitality, the adaptogen, and 100% across the board. When we were taking from different stock, that 100% what they said was in it was actually in it without contaminants, and that was powerful, and that meant a lot. So it brought up the trust level of this product. And it wasn't just that, of course, it was the clinical response that we were seeing in our surgical patients and in our wellness and our health and our obesity and our hormone patients. So we were watching the response and we were measuring. So that was pretty powerful.
Yep. And as we kind of we talked about antioxidants and nutrition. Well, what we also know is that this role of gene expression science is really significant. And to put all these pieces together is really what ageLOC science has been able to do, to be able to identify the genes related to aging. It's now empowering Pharmanex to target those genes with different formulations to reset your gene expression back to how it was when you were younger. This is all patented technology where these gene chips now, they can measure what aging looks like on a genetic level. This is what happens when you're young. These genes are active. These green genes are less active. So this is a young, healthy DNA. When you get older, it flip-flops. These genes turn on and the bottom genes turn off. And this is what aging looks like from an epigenetic standpoint. And this is why we have less energy, more wrinkles, tissues don't regenerate as well, more inflammation, metabolic issues. It's all because of the genes are changing their function as we get older. It's almost like having a really nice instrument, and over time, that instrument just gets out of tune. It doesn't matter how well you play it, that instrument is out of tune. And so the theory is can we screen for ingredients that are thought to be good at slowing down aging, and can we make these genes go back through a nutritional intervention? So the database came from all the studies that were done on caloric restriction, which is the only research that's ever been shown to have an outcome that can slow down the aging process and significantly reduce age-related diseases. And so if we see here on the left, this is the desired gene expression, this is the old expression. And what they can do is start screening different ingredients to animals to see which ones can actually reset the genes. And so if you look at ingredient number one, ingredient number one still looks like an old gene. Ingredient number two has a little bit of an effect. But as you can see, they look at number 4. It really sticks out here, and number 4 almost matches up identical to a desired gene expression. So what this is doing now is resetting or restoring the function of genes. They came out with some products. One targeted mitochondrial function, and then age-locked youth actually mimics the effects for caloric restriction for the entire genome. It's scanner certified, meaning it's been shown to dramatically improve antioxidant scores, so it's very easy to demonstrate to your patients in their practice. But what it's also doing is it's targeting 6 of the major aging defense mechanisms: antioxidant defense mechanism, both exogenous and endogenous, systemic detoxification and stress response, DNA protection, repair mechanisms, inflammatory balance, tissue regeneration, and mechanisms regulating metabolism. And this is affecting everything in the body, from individual cellular health to brain health, heart, metabolic health, skin, bone, joints, eyes, physical and performance, and immune health. All these things deteriorate as we get older, and this science allows us to get to the sources of that to reset that. And so there was a study that was published in the Journal of Cosmetic Dermatology showing the effects of this product. On the top here, this is the control group. So what they did is they took skin, they exposed it to a UV gun at different increased frequencies or intensities. So this is the 1 minimal erythemal dose. So this is the minimum amount that caused redness. This is double that dose and triple the dose. And with the age-locked youth product in just 2 months, you can see that same level of radiation caused almost no damage and a significant reduction of about 70% in the higher doses. So not only is this decreasing UV damage and cell damage and DNA damage, but it's also dramatically decreasing inflammation. And we know that the skin is a very good model for looking at inflammation systemically. They also looked at brain health, which is a big concern of patients. And so this is the cerebral cortex when it's old, right? So this is an old cerebral cortex. This represents about 1,000 genes in the cerebral cortex. This is what caloric restriction does to the brain. It basically keeps those genes functioning young in the brain. And the goal is can we find a blend of ingredients that mimics that? And so this is what the old tissue does with the age-locked youth product. You can see that it's almost identical to what caloric restriction does as that gold standard. So rather than just trying to upregulate or downregulate a gene or two, they're actually able to match this up to an outcome. And that's producing not only genetic results, but also functional results in humans. This is a study done with functional brain MRI scans. On the left-hand side is the control group. What you want to look at here is the size of the area that's being activated. And in 2 months of supplementation with age-locked youth, you can see a lot more brain activation here compared to the control group. This was actually done at the University of Utah, and this study is going to be published shortly, and we'll keep you guys up to date on that. And so as we blend into clinical applications to this, Ben, I don't know if you want to touch on any of these things, but we look at nutrition. It's not one of those add-on things. It's one of these things that should be really a foundation of treatments. And so whether you're just managing traditional medical outcomes with patients, or you're trying to keep patients healthy, or you're looking at hormones, PRP, stem cells, exosomes, this is an adjunct foundational therapy. And, Ben, if you jump on here and you want to add to that, feel free to. But also being able to document that you made nutritional recommendations and you measured, could also provide some medical legal protection for you, and it also improves the overall health of the patient. So significance of carotenoids. Some people say, okay, you're measuring carotenoids. What does that mean? Well, high levels of carotenoids, according to this study here published in Internal Medicine, showed that high carotenoids reduce the risk of cancer, heart disease, and all other causes by 39%. This was a 14-year study. They play a big role in vascular aging. They play a big role in eye disease. They play a big role in non-Hodgkin's lymphoma and other cancers, persistent HPV infections, rheumatoid arthritis, and other autoimmune conditions. This is one on cognitive function in elderly population. In fact, if you do a PubMed search on oxidative stress, antioxidants, or carotenoids, and you name the disease, you'll see thousands, if not tens of thousands of peer-reviewed studies showing the impact that antioxidants can do for the health of your patients in preventing or treating these diseases here. So as we look at the revenue stream, there's two revenues streams in this business model. One, there's revenue in testing, and then there's a residual revenue on the supplements. Most doctors charge $20 for the test, and as you can see, Ben tests every patient, and he talked about why he does this. So if you're seeing 5 patients a day, you're looking at $25,000 a year in cash revenue just from testing. You don't need to fight insurance companies for this. 10 patients a day, 15 patients a day is $75,000 a year cash in testing before you've even sold any product. So when you can couple a product with a test, not only are you going to provide more value to your patients, but you're going to bring in a whole revenue stream, and you're going to keep those patients more connected to your practice because you can validate that what you're doing is making a difference. Now, in addition to the testing side, here's the revenue on nutritional therapy. We know that 77% of your patients are already buying a supplement. If you're in anti-aging medicine, it's probably closer to 100%. But if we just look at the average practice having a few thousand patients, and we just say, let's say 5% get converted over, 100 patients on product is $35,000 a year in residual income in addition to the testing fees. 200 patients, if you can get 300 patients on the program, you're looking at $100,000 plus testing fees. And what's nice about this is there's no inventory, there's no billing. You don't have to track anything. You don't have products getting stolen or expired. This is all shipped and processed directly from Pharmanex for your convenience, and then they send you a check weekly based on what your patients are purchasing. The investment is pretty low. It's $33.95, and that's $3,400. I want to make sure everyone knows it's not $34,000 because sometimes people make that mistake here. And that gives you everything you need to get started. It gives you a bunch of scans, gives you a bunch of product. It gives you access to our training and all your marketing material and coaching that you need to be successful with the program. The only expense of keeping the program going is the device is actually leased to you for free on a month-to-month basis. And $125 a month covers the service contract on the scanner, gives you an additional 50 scans. All of your software and hardware updates are included. And so anything that goes wrong with this is going to be covered, and they typically will replace the devices or fix them within 24 to 48 hours to make sure that you're continue to be up and running. And so we'll have a Q&A here, but we will have a survey at the end of this webinar that will pop up. If you could please take just a couple minutes to answer those questions for us, get back to the person that invited you onto this webinar and schedule a call with us if you want to get started or have some questions. If you want to jot down the time or the date for our next conference, it's January 16th to 18th, and that'll be at our global headquarters in Provo, Utah. So if you guys have any questions, feel free to type those in the chat, and we'll do our best to answer those. One person had asked, I think this is Dr. Tom, is there any competition to this? No, Pharmanex has the exclusive rights to this technology. There's nothing else competitive to it out in the marketplace. And does gut health affect results? Yes, gut health can affect results. So patients that have bariatric surgery will have very poor scores. They're in dire need of supplementation, and it's going to take those patients a little bit longer to get their score up, and they're not going to get up as high as somebody that hasn't had that surgery. Any type of like Crohn's disease or those types of things will also impact the score, but on the supplements, we can still have significant improvements with patients despite the gut health issues that they have. Yes, we can test children. I usually have a slide in here with my 3 kids. I have 3 children, 7, 5, and 2, and we test them as, you can test infants. It's safe for children, and it's really fun because you can gamify nutrition for children, and they respond immediately. I mean, kids will change their diet at their next meal because they don't want to lose. They want to beat their brother or their parents with their score. And, we have kids changing their diet immediately. It's a lot of fun to test children. Any other questions that we have before we conclude the webinar? Okay, looks like we've got all those questions answered. So again, we'll conclude the webinar. Thank you for joining us. Again, please take the survey and get back to the person that invited you onto the webinar. Thank you so much, everybody. Have a great evening.